I think I get a lot of satisfaction when I know that I can connect with the patient and be able to be there with them to support them. I'm Dr. Kathleen Lin. I'm the medical director of RMA Seattle. I was accepted at Yale University, and that's where I spent my undergrad years. From there, I went to medical school at Albert Einstein College of Medicine. My residency was at New York Presbyterian Hospital. I then did fellowship at University of Pennsylvania in Philadelphia, and am now the medical director of RMA Seattle. I think what's really important for me as a physician is the continued practice of medicine. It's not possible to be good at your craft if you don't practice your craft, and if you're not there for pretty much every piece of the way. I don't think there's ever a case where I feel like, oh, I'm comfortable enough to know exactly what's going to happen. I think that what's most important to me is that patients know who's making decisions for them, who's caring about them, not just the person who's in front of them, but all of us behind that person, and that they feel comfortable enough to tell us when they're not comfortable with something or that they're confused. It gives me and my team an opportunity to think, why is this happening? Let's think about it. Let's try some ideas. And now we've taken this big, complex, scary process and made it much more tolerable, made it much more hopeful, less noisy, so we can actually focus on the actual medicine part of it. And I think through that, we've built an environment where people know that we think outside the box. We like to individualize both our care and our approach, and it's been a place where people feel safe. Common misconception that patients often bring in with them is this idea that if they're going to freeze eggs or freeze embryos, that somehow their eggs and embryos will degrade or lose quality over time, which of course is how you might think when you've got a bag of peas, let's say, in your freezer. The fact is that once we teach them about how tissue freezing is done, essentially their tissue has biologically stopped in changing, and that they could come back at any point in the future to use the tissue using the freezing technology that we have. RMA is an industry leader with a very old-fashioned mission, and that is to have the best outcome possible for patients and the best experience possible for patients. Patients are all given the most individualized and creative options. They're involved in the selecting of protocols and their treatments, and it's all for the best outcomes possible. I couldn't imagine a life better lived. I feel extremely fulfilled as a physician, as a provider, as a carer.